One of the things that we did that's different or innovative is a staged approach that entailed trying to separate distance-wise the children from one another to give ourselves a little bit more room to work. And we wanted to see how that would affect these really large blood vessels that are just in the back. And so we applied a technique called distraction osteogenesis that allowed us to basically, in a very slow fashion, pull the twins apart by a couple of centimeters, which just gave Dr. Hoyer and the other neurosurgeons a little bit more room to work, because the real estate here is incredibly precious, as you might imagine. And in addition to brain, which is very precious real estate, these really large blood vessels that are in between the twins have to be separated and given to one twin or the other. And by giving them a little bit more room to work by using this process called distraction osteogenesis, I think we were able to make that process a little bit quicker for them, a little bit safer for the twins.
The biggest part to separate them, the scariest part, is where these two large veins called the sagittal sinus come together in the twins. And this is where they were connected unlike any other place in the brain. And so this couldn't be cut and sewn together into another vessel. This has to be cut, sewn across, and occluded so that it doesn't bleed. And 20% of your cardiac output in an adult goes through your brain, even more so in a child. And so separating that can be a scary moment, because there's going to be bleeding in that when you do that separation. And you just want to minimize that blood loss or control it to a degree where the babies can still be stable. So that's the third part, is separating that major blood vessel. The last part, which we had to think about during the whole case as well, is then once they're separated, we have to close them. And that's where the plastic surgery team and the neurosurgery team, again, worked hand in hand to bring the skin and the coverings to the brain together.
The big challenge we face from a plastic surgery standpoint is a deficiency of some really critical tissues: skin, the subcutaneous tissue, the skull bone, and then the covering of the brain. And not only are you missing it in one baby, but essentially you're missing it in two babies, because they're both connected at that location. And so you have to engineer for them a skull replacement and a scalp replacement and a dural replacement. And you've got to do it on the spot, because both heads obviously have to be closed at the end of the operation. So that's the big challenge we faced. I feel like we planned for that challenge really well, and as a result, they've done great so far.